Hello, my name is Dr. Alan DeVigi. My specialty is oral and maxillofacial pathology here at Oralast. About 5 years ago, I noticed that there was a real demand for clinical oral pathology services. Traditionally, pathologists is in the lab. We're looking at biopsies with a microscope. We're looking at radiographs, and there's not a lot of patient contact. Referring doctors who sent us biopsies were at their wits' end with a lot of patients, so they asked us to see them clinically, which we did in our lab. We put a chair down in the middle of our lab and we saw these patients. And needless to say, they were kind of surprised when they showed up. But just by word of mouth, we didn't advertise that service. We just provided it to our referring doctors to help them out. It got very busy, and we noticed that there was a real demand for clinical consultations. So I started Oralast in this year, 2019, here in Scottsdale, Arizona. We still have the lab in San Diego, California, and Dr. Davies sees patients still in the middle of the lab there at times. When a patient first presents for treatment here at Oralast, we take a detailed medical history. We gather all the information from other doctors like imaging, blood work. Sometimes a patient needs a biopsy. We don't do any of that here. We try and minimize that, but if needed, we'll refer the patient back to their primary care provider or their referring doctor, or we can arrange for them to see the appropriate specialist for the test that they need to have done. After we gather all the information and we make a correct diagnosis, we can often effect a cure, or we can get the patient very comfortable if it's a chronic condition. We can provide maintenance therapy. With a comfortable mouth, the patient can be restored back to optimal health. At Oralast, when you come to visit us, you will notice a retail space. We've created the retail space to make it easy for our patients to fulfill their special needs. A lot of my patients can't tolerate regular toothpaste, so I've created a special formulation just for those specific conditions. But we have a number of other products that we've carefully screened. They're doctor recommended, they're recommended by me. Everything from cleaning instruments and tools for your oral health, apothecary products that we've screened carefully, and of course salivary diagnostics that patients can purchase themselves if they're interested.
Well, initially the pain and discomfort started about 3 years ago, and initially it started when I would eat something and I would just have one bite of anything, it didn't matter what it was, and I felt like a film across my mouth, and it was very, very uncomfortable and rather unsettling because it just didn't feel right. And it used to drive me nuts, so I had to brush my teeth over and over again. But I still had that film, so it was, it really was uncomfortable.
I had a lot of canker sores. I had gum bleeding, like excessive gum bleeding, and I had like a searing pain in my mouth after every time I brushed.
For me to have any sort of issue, I had an issue with my mouth, and being married to a dentist and an oral pathologist, it was very handy because I would say, Al, what is going on?
In response to that, he told us to eliminate all oral care products and see if anything changes. Like if the pain goes away, the canker sores lessen, my gums start bleeding. And that's what we did.
And that's what we did. We took away all oral hair care products. It took
for about 2 weeks.
Yeah, for about 2 weeks.
2 weeks.
Making 2 weeks, and it was a hard 2 weeks because, you know, you have your routine, you have your habits of oral health care, and we eliminated all of that for 2 weeks. We gradually introduced different products that, you know, say that they are good for sensitive mouths, which that's what Megan and I determined. We have sensitive mouths. And these brands worked for a while. They would work for about a week, I would say, Megan?
Yeah.
But then it all started to resurface again. So Al noticed that we had some issues, obviously, so he put his scientific cap on and formulated a toothpaste that would alleviate all these symptoms that we were experiencing. Once we started using Al's toothpaste, it was amazing because after a few days, the canker sores were gone. That film, thank goodness, was gone. And my mouth felt good again. My mouth felt healthy.
The gum bleeding went away, the tooth sensitivity, and the burning sensation completely gone.
It really helped us, and we hope it'll help you too.
Hello, my name is Dr. Alan DeVigi. I founded Oralast. My specialty is oral and maxillofacial pathology. I created Oralast toothpaste because my wife and my daughter were having problems, and my diagnosis was they were sensitive to their oral care products. My wife was complaining of a film in her mouth and discomfort, and she had some taste alterations as well. My daughter was complaining of canker sores and bleeding gum. I did go ahead, made a diagnosis for my wife of desquamative gingivitis, desquamative mucositis, and my daughter was suffering from recurrent oral aphthous ulcers or canker sores, and as well as bleeding gums, just generalized mucositis. So at that point I said, okay, the most common things are most common, probably an allergic reaction to the oral care products. I see that a lot. So we tried different substitutes, but really couldn't find anything that would alleviate all their symptoms, so I formulated Oralast toothpaste. And that's when I realized, you know, I have a lot of patients out there that really suffer from the same thing, and I've treated them in the past, and this could help a lot of patients. Oralast toothpaste is specially formulated for patients with sensitive mouths. So some of the harmful ingredients in toothpaste that a lot of patients can be sensitive to are the detergents, SLS, sodium lauryl sulfate. That's why the toothpaste foams up in your mouth. And that's usually the main reason why your mouth tingles after using it. All that detergent has irritated all the mucosa. A lot of patients are sensitive to the strong flavoring agents, the mint, the spearmint, especially cinnamon. A lot of patients are sensitive to fluoride salts like stannous fluoride, sodium fluoride. So those are the ingredients that I've eliminated, and it worked very well for them. They're using the Oralast toothpaste. They haven't experienced the canker sores, the desquamative gingivitis, and they're much more comfortable now. So basically, Oralast toothpaste is water, a mild abrasive, calcium carbonate, humectants. These are ingredients that help keep the toothpaste moist from drying out, like sorbitol, and that's about it. It's a very simple formulation. So if you're having burning mouth, canker sores, a film in your mouth, Oralast toothpaste may help you. Give it a try.